Hello, amazing massage therapists in Australia. My name is Robert Libbey, registered massage therapist in Canada, and I am going to be presenting at the 2025 Massage and Myotherapy Australia's National Conference in Perth. I have written for your journal a number of times, and I'm extremely honored to be asked back on a regular basis. And thank you so much for all of your positive, amazing, supportive comments that you've emailed to me. I'm going to be teaching in Melbourne. I'm going to be looking at ligamentous articular strain techniques for the sternum and for the hip and the pelvis. This is going to be a full contact, amazingly full information, pain science, evidence-informed manual therapy course. Because, there's a number of ways that hips and pelvises and people with chest discomfort come into our practice, and they typically present with some type of experience with pain. And it can be quite confusing and quite stressful and frustrating for not just the patient, but also for the therapist. And a lot of times I'm sure that you're just like me, throughout the day, and at the end of the day, you sit there and you go, what am I even doing with these people? How am I acquiring my outcomes? How can I improve my outcomes? How can I improve the quality of life of my patients? So we're going to talk about ligaments, joint capsule tissues, the nervous system. We're going to talk about the sensory properties of the ligaments and joint capsules. We're also going to look at their mechanical properties. We're going to look at the neurological innervations for the sternum, for the rib cage, for the clavicle, for the first rib, for the manubrium. We're going to also look at the neurological innervations for the hip and the pelvis. And we're going to talk about some amazing case studies that I have for you. We're going to talk about the anatomy for the sternum. We've got some pericardial sternal ligamentous tissues that we've got to talk about. We're going to talk about, this is a case study from my own practice, so have a good look at this image and remember it, because there's some things in here I haven't highlighted, so we're going to talk about this when we get down there. We're going to talk about how ligaments, joint capsules get injured. We're going to talk about how they heal. There's wound healing stages that they all go through. And there's new timelines for acute, subacute, and chronic that is going to impact your practice and how your patients perceive their healing abilities. We're going to talk about some research. I've done 3 research papers, one looking at arthrotomes, which are the neurological innervations for joint capsules, ligamentous tissues for the whole body. We're going to talk about ligamento-muscular pain reflexes for those areas. And then we're also going to look at the documented ligamento or ligamentous pain referral patterns for the body. We're going to talk about how we can improve our outcomes with our terminology and the narratives, the stories that we tell our patients, so that we can work with our hands and with our knowledge in clinic. We're going to talk about the 7 effects of treatment and the top 5 questions that every patient, no matter what they're coming into your practice with, the top 5 questions that they've got that they want answers for. So we're going to hopefully get the patients thinking that they're not just broken and that they need to be fixed, but that everything is awesome and that we don't fix in our practice. We're going to try and calm down everybody so that we're thinking a lot more clearly. We understand how we get our outcomes. We've got a better understanding of how the nervous system plays a huge role in our acquired outcomes. It was amazing to see Gary and Dave and Anne when they came up to our association's conference in Vancouver earlier this year, and I can't wait to see them all back in Perth. So looking forward to seeing you guys in Melbourne. Come out to the course. We're going to have an amazing time, tons of information that you can immediately put into your practice, and I look forward to seeing you guys. Thanks, guys. We'll see you soon.